What do organizations need to, I guess, put these standards in place or to develop these mechanisms? I think that you really need insight. You need a committed senior management. You need your committed medical staff. You need your committed administrative staff. You need a very committed governing body and a CEO to say this is something that is so important, that patient safety and quality really rely upon a well-functioning staff, a staff that recognizes that there will be moments when conflicts do occur, when there is disruptive behavior, that conflicts may well impact patient safety and quality of care. And now is the time to bring all of us together to be open about this. And I think that's another thing. You need to create an atmosphere where the staff, the individuals feel comfortable and safe, where they trust senior management and know that senior management will support them in what they do.
The role of organizational leadership in providing that safe environment is to be able to listen, to be able to understand interdisciplinary relationships, particularly in this complex time. We are dealing with sicker and sicker patients, high volume of those sick patients, and if the leadership understands that, understands the stress that usually occurs within those kinds of environments, I think the door is open then for a discussion that would allow change to occur.
For an executive to address unproductive or disruptive behavior in an organization, the most important first step is to acknowledge how that's allowed in the first place. So usually it's not an executive one day getting very clear about disruptive behavior and how to handle it and what to do about it. It's to say, that goes on here. I recognize that. In the past, I've allowed it to happen because I haven't really associated its impact with everything else we're trying to get done. So step one for an executive is to say, I've allowed something to happen, I do need it to stop, and it's going to begin with me calling out or saying, yes, that's real and it has an impact.
What we find in healthcare, as we do in many other complex socio-technical systems, many other industries, is a tension between production. In healthcare, that manifests itself by providing as many services to as many patients as possible. And on the other hand, protection, or providing those services in a safe way. That tension between production and protection inevitably leads to conflict, and usually on the organizational level, important goal conflicts. Those set up all of the staff who are trying to help patients with double bind situations where they either have to take chances to provide the services or significantly, in order to do so safely, reduce the number of patients that they can serve. So that's a constant tension. That is true in every system that we look at, and it is very true in healthcare. So safety is not the only priority of a healthcare organization, and that's quite understandable. Unfortunately, it is unusual for there to be a clear, honest, and transparent discussion of that tension so that all of the parties can understand what the priorities are. And in those situations where there is conflict between teams or within teams, healthcare has been very slow to come to a realization that there are ways of resolving those issues, dealing with those issues, identifying those issues, and helping the healthcare workers to sort them out so that they can carry on with their primary task of helping patients.
I think nurse leaders have extraordinary opportunity to support nurses in conflict. I think the first and hardest step is actually taking it seriously, is reframing that from, and reframing is a skill that I think is essential here, reframing it from, I don't want my nurses to complain, to what is the story this person is telling me and what does it tell me about the conditions of patient care delivery that may be being created. How do I listen to the story? How do I ask effective questions that help me unearth what's really going on here? And how do I find, either in myself or in other resources, a way to help that person find their way back to a better place?
I think the most important thing that a patient safety officer can do to help healthcare providers come to a better understanding is to talk about the role of conflict. Secondly, it's important to provide adequate training and support services so that people can resolve conflict at a much earlier stage. That requires them recognizing that there is such a problem. And there will be times when there needs to be specialized input, as with a mediator, and a healthcare system that wants to deal effectively with conflict and to reduce its impact on patient safety will also provide those opportunities. So it requires training to recognize that there is conflict, training to acquire skills to deal with conflict. When people are given the opportunity, they would prefer to sort out these conflictual situations at the earliest occasion possible. But quite simply, we don't provide them with the skill set, and often their job doesn't provide them with the time that's required.
What will be important is for organizational leaders to provide options, that we have both an enforcement mechanism but also an engagement option, where we help health professionals have the conflict competency to be able to engage early and directly with each other, and that we provide the backup and support for those health professionals so that when they do make the choice to engage, that we back them up in their efforts.
Some conflict competencies I emphasize: active listening, the ability to ask good questions, the capacity to make sense of the conflict before you make a judgment, conflict analysis, sophistication, the ability to differentiate between an individual's problem and a system's problem, the ability to get the perspective you gain from taking 10 steps back, to get a wide lens on the picture. Those are examples of probably some of the things I think are most often needed and not there, so to speak.
Not holding people accountable punishes your best performers, and that workforces, leadership, people with vision and clarity, regardless of where they are in the organization, are starved for an environment where they can live out being productive and wanting to be there and doing what they've been hired to do, their calling, their mission, why they get up in the morning.
So as we start to look for ways to address disruptive behavior, unprofessional conduct, or conflict in healthcare organizations, we really want to look for options that are congruent with the humane way that we approach our work, that are aligned with our healing principles. So we really want to start to look for what are ways in which we can engage in conflict that help to promote healing, promote professional conduct, and allow us to do the meaningful kind of work that, as clinicians, we have always wanted to do.